We're going to talk about the study of epidemiology. My name is Dr. Mohammed. I would like to talk about study of disease outbreaks. In every discipline, there are particular tools available for us to study and understand a discipline. In epidemiology, the tool we have started with statistics, and the Royal Society for Statistics were put together way before understanding of epidemiology. But epidemiology is basically studying the etiology, how diseases are transmitted, how these outbreaks occur, and how we could do surveillance, screening, and using the new technology to be able to understand the disease outbreak and even conduct clinical trials to be more scientific. As an epidemiologist, we use a language of statistics to be able to communicate disease occurrence to our public. Epidemiology study of how disease occurs in the population and the outbreak, the onset, and is the pattern in which occurs in a different setting, in different context, in different environment. So we basically call epidemiology a population medicine because we don't just look at an individual, we look at the whole society. We look to see number of people who lose their children, number of people who die, and we collect this information to be able to understand the status of a society. Sometimes we find there's a big difference between poor people and the rich people. Sometimes we find that there's a difference between people living in a different location, different areas. So socioeconomic status and many other factors impact the occurrence of disease. So we gather data to be able to understand what is going on so we could prevent and find effective methods to prevent diseases in the population. Biostatistics and biometrics, as I said, we use the statistics, we rely on statistics and biology to be able to bring mathematics and biology together to understand and draw some scientific conclusion to try to find the cause and effect of disease in our population. Epidemiology is how disease is distributed in the population. So when we have an epidemic, we have large number of occurrence of illness or disease that at some peaks in the population, sometime in a particular season, we call that an epidemic. We have flu epidemic, we have many other epidemics, especially in the fall season when many children go back to school. Endemic is a disease occurs that regularly occurs in a population. And pandemic is when disease crosses a boundary and goes from one country to another. So what we call like Chinese flu or Korean flu and all these names we call them, these are diseases that cross boundaries and affect large number of people. The epidemiology, studying the disease occurrence, goes way back. But the most recent epidemiological studies that was really documented evidence was John Snow. He did a fantastic study of looking how cholera is occurring in the cities based on transmission of drinking water. John was very famous investigating cholera, and he basically used a broader street to be able to look at the different pumps and plotted the number of cases around this pump to determine which area was more contaminated, which well was contaminated. Olden days they used to think bad spirit or some people poisoning the wells, and that's how the population is affected. Individuals who practice, for example, Jewish community who practice kosher were not affected by this disease. Oftentimes the other population basically thought they are the one who are poisoning the wells and basically affected them in the community. Diseases that changed the world, basically 12 diseases were rampant, killed millions of people. Smallpox, tuberculosis, syphilis, AIDS was most recent disease, but influenza, bubonic plague, cholera, malaria, yellow fever, these diseases were killed millions of people. Their diseases are categorized sometimes to non-infectious diseases, hemophilia, porphyria, plant diseases, or basically are not necessarily affected individuals. Some diseases cause famine because it affects the vegetation, like potato famine in Ireland. Zoonosis are defined diseases that are basically transmitted from animals to humans. Equine influenza, horse flu is a disease caused by strains of influenza A and exotic in horse species. Influenza outbreaks have become devastating, cause economic devastation, particularly in military, cavalry, and other individuals who are involved working with horses. Four most common type of epidemiological studies we call cohort studies, case control studies, occupational epidemiological studies, and cross-sectional studies. We'll go through these things and explain them in more detail later. One of the key organization, the WHO, which is the World Health Organization, has got several examples that I want to present to you on epidemiological operations that they've done. Well, the number one, as you know, epidemiological mission is to do surveillance and develop some kind of early warning signals, be able to affect, be able to warn people. Example, were Pakistan flood, Myanmar cyclone, Horn of Africa flood, Lebanon, Pakistan earthquake. All of these tsunami all affect large number of people, and we try to develop surveillance and measures to prevent them. Outbreak of investigation response, cholera in Haiti, Pakistan 2010, measles in South Africa, or many other diseases in other part of the country that we need to respond very quickly, because if we don't, it will affect elsewhere in the world. If you can see Zimbabwe, Somalia, Uganda, Jordan, Chad, Iraq, Libya, these are countries oftentimes in the middle of war. So the outbreak of disease, especially cholera, because it affects the drinking water, contaminated drinking water, affect large number of people. Surveillance is also monitoring is extremely important. Darfur, South Sudan, polio eradication activity, Congo, Libya, Central African Republic, and India, Angola. These are also be able to survey and monitor the eradication of Guinea worm or plague many countries in Africa. We also look at what we call social epidemiology. Instead of chasing particular disease, we look at factors within the society that influence health. We call the social determinant of health. Occupation, income, education, all called social determinant of health. Economic status of population. That's why we use the word health disparities in our discussion. That concludes our discussion at this part. I'd like to thank you. We'll go back to part 2, epidemiology. Have a good day. It's Dr. Mo. Take care. Bye.